All right, so good evening, everybody, to the third installment of our Suicide Prevention Month, both live on Facebook and for those of you that are joining us on the Zoom side. As always, I will start the evening by saying the content of this presentation is proprietary and confidential information of the Florida Firefighter Safety and Health Collaborative. It is not intended to be distributed to any party without the written consent of the collaborative. Attendees should note that the educational component of this session is being recorded and will be published on the Florida Firefighter Safety and Health Collaborative's YouTube page. To maintain complete confidentiality, an announcement will be made before the recording begins, and only the presenters will be identified during this recording. Therefore, to ensure complete anonymity, now I gotta change that word, all attendees are asked to mute their microphones until an announcement is made that the recording is complete. Presentations are intended for educational purposes only and do not replace independent and professional judgment. The ideas expressed in this presentation are the professional opinion of the presenter and do not necessarily represent those of the Florida Firefighter Safety and Health Collaborative or its constituents. Before acting on any of the information presented, attendees should consider the appropriateness of the information as it pertains to their individual situation and seek independent professional advice should any concerns arise. If you or anyone you know are in what are believed or perceived to be a situation that is or may become harmful, please reach out to the National Domestic Violence Hotline via phone at 1-800-799-SAFE, 1-800-799-7233, or through their website, thehotline.org, or as always, in the event of an emergency, dial 911. With that, we are grateful to have our presenters this evening, Claudia and Morgan from Osceola Regional Medical Center and from the Jason Foundation. And Claudia, if you'd like to make our introductions for the evening, I would be very grateful.
Absolutely. Thank you so much, Michelle, again, and Florida Safety Collaborative for inviting us to be part of this important event, such an important month, such an important topic to talk about regarding suicide prevention and awareness. So my name is Claudia Swanger. I am the Director of Community Outreach for Osceola Regional Medical Center. I will briefly introduce our program and our services, and then I will introduce Morgan and the partnership that we have with the Jason Foundation. So we are Osceola Regional Medical Center Behavioral Health. We are located in Kissimmee, Florida. Next slide, Morgan, please. So we do fall under the HCA Healthcare umbrella. These are just some of our sister hospitals in the Central Florida area, recently added UCF Lake Nona Medical Center. So our mission is above else, we are committed to the care and improvement of human life, and that is shown through the services that we offer in all of our hospital settings. Next slide, Morgan. Just to show you HCA Healthcare, not only do we have medical hospitals, but behavioral health hospitals all throughout the country. As you can see, we have a huge presence in the state of Florida, but we are all over from California to Virginia to Tennessee, which is where our home office is. Next slide. So at Osceola, we have both inpatient and outpatient behavioral health services. Our inpatient program, we have a Baker Act receiving facility. All our services are for adults 18 and up. We have a 25-bed facility where we offer 24/7 psychiatric services, discharge planning, case management, music therapy, art therapy, recreation therapy. We pride ourselves in our discharge planning to make sure that our patients have all the tools they need when they are discharged from our program. Next slide, Morgan. And this is just some criteria to be admitted for our program. We also accept patients that want to come voluntary. So not just somebody who is under a Baker Act, but just somebody that really needs to take a break and needs perhaps some adjustment in their medication and that 24/7 psychiatric care and therapy. We can also provide those services. Next slide, Morgan. We also offer outpatient services, PHP, which stands for Partial Hospitalization Program, and IOP, Intensive Outpatient Program. So this is a higher level of care of counseling and just regular individual counseling and psychiatric services. This is for somebody who's stepping down from a Baker Act to help them transition back to work and life, or for somebody who needs a higher level of care, like I mentioned, of just individual counseling. We do offer psychiatric care and group therapy. Group therapy includes coping skills, relaxation skills, DBT, CBT, even medication management, some psychoeducation groups as well. And we recently started Spanish groups in our intensive outpatient program. That is a new service that we are offering. Next slide, Morgan. These are just some benefits of PHP-IOP. It just helps transition back to, after being in an inpatient setting, individualized treatment plans. There's medication management and group therapy 3 to 5 days a week. Next slide, Morgan. We also have a continuity clinic, which is individual psychiatric services. We offer that with our residents in psychiatric training who are under the supervision of a board certified psychiatrist. Next slide. And we offer ECT services, electroconvulsive therapy. It is the most effective treatment for severe mood and psychotic disorders. These are for those medication resistant patients that have tried lots of medications, counseling, multiple hospitalizations, and nothing seems to work. It is evidence-based, very effective, and this is done on an inpatient and outpatient basis in our hospital. Next slide. So this is me. This is my contact information, email, cell phone. Meg Young is our program director. Please do not hesitate to text me, call me, email me. We cover not only Osceola County, but also Polk, Orange, Seminole, and Lake, and sometimes even Brevard. Please let me know if there's anything that you need, any resources. I have gathered a provider list of resources for first responders to ensure that these are providers that have training with working with first responders and experience and that can accept your health insurance. So please, please don't hesitate to reach out to me if I can help you or your family member in any way. Any questions about our program? And we can always leave questions for at the end as well. So it is my pleasure to introduce our speaker from the Jason Foundation. So HCA Healthcare, we are a proud partner of the Jason Foundation. So Morgan Marks, he's the National Director of Division and Manager of Operations of the Jason Foundation. He earned a Bachelor in Science in Management, Human Relations at the Trevecca Nazarene University in Nashville, Tennessee. He has worked at the Jason Foundation for over 14 years in helping the fight with the silent epidemic of youth suicide. Morgan resides in Gallatin, Tennessee with his wife, Crystal, and their 5 children. Take it away, Morgan.
Thank you, Claudia. Thank you, Michelle, for having us as well, too. And of course, I wanted to talk a little bit about the Jason Foundation. We're a youth suicide prevention organization in Hendersonville, Tennessee. We lost Jason when he was 16 years old. Hopefully we'll get invited again and we'll go through greater detail, maybe Jason's story, but I want to give you a little bit of information about us, our mission statement. We're dedicated to the prevention of the silent epidemic of youth suicide through educational awareness programs that equip young people, educators, youth workers, and parents with the tools and resources to help identify and assist at-risk youth. So what can you expect today? It's not going to make you a counselor or anything, but we're going to talk about awareness of the problem of youth suicide and how to help. A look at awareness and prevention of suicide within the first responder community. And like I said earlier, it's not to make you a crisis counselor or anything of that nature. It's just to give you some information on suicide. Awareness. We refer to suicide as the silent epidemic. Who best described it? You see who a lot in the news, the World Health Organization on COVID, but they basically summed it up very well. The prevention of suicide has not been adequately addressed due to the basically a lack of awareness of suicide as a major health problem. That's where we call it that silent epidemic. We just don't talk about it a lot. You know, we see the numbers on COVID, we see the numbers on a lot of things on the news, but we just don't talk about how many people we lose to suicide. Suicide in our nation, it's the 10th leading cause of death for the United States. And these are not our numbers. These are coming from the CDC and Whiskers. 10th leading cause of death for our overall in the United States. If you look at the youth where Jason Foundation, where we work with the most, suicide is the second leading cause of death for the 12 to 18, the second leading cause of death for that 18 to 22, and also for the 10 to 24 age group. Second leading cause of death in our nation. If you look at the overall of 10 through 45, let's even open the numbers more. Suicide is still the second leading cause of death in the United States, and we're still not talking about it. Each week in our nation, we're losing approximately 125 young people to that 10 to 24, 125 young people to this silent epidemic of youth suicide. Just think if that was a virus that I was talking, you know, we know in COVID, what if this was some type of virus that was taking 125 kids each week in our nation? I guarantee you we would be talking about that. There'd be something that the next debate, the next thing that election time would come, we will be talking about. What are you doing to stop that virus from taking this young person on the street, someone in your family? Guarantee that would be one of the main things that we're discussing. And it's not a virus, but it's taking just as many lives. Now, girls are 1.5 times more likely to suicide more than boys. And if it was a live audience and I could get questions back and say why, and there's so many. If you know the answers to this one, please contact Claudia and Michelle, give us the answer. We don't really know why. There's a lot, you hear a lot of great answers of why girls are more in tune with themselves, but there's so many things, wonderful answers. We don't know why on that, but we do know boys are almost 3 times as likely to die by suicide. And we do know the answer to this one, and some probably know. It's the choice of means. Girls have chosen drugs. It kind of gives you that window of opportunity. You may not even find them that night. Maybe the next morning may have caused liver damage or something of that nature. But you have that window, that opportunity for intervention. And boys usually choose firearms. They're familiar where the gun's kept and how to load the weapon. But we're starting to see a large trend. It's a trend that started some time back ago. We're starting to see it more and more. Girls are turning over to different means. They're already, attempting 1.5 times higher. So girls are starting to move over to basically hanging. And if this number continues to go, and you're attempting more, but boys are out doing more than 3 times higher than girls, this number is going to get extremely high. It's something that the Jason Foundation, we've been looking at it for a long time. So this trend it's frightening us. There's CDC does another thing, and it's called the Youth Risk Behavioral Survey, and they do it every 2 years. And they go and ask students in classroom. There's a plethora of questions. If you write that down, just type in YRBS, everything from were you wearing your seatbelts? Do you have smoking in youth? But they ask them 4 questions that pertain to suicide, and we're going to go over those right quick. Last time they done this survey was in 2019. Keep that in mind. That's prior to COVID, because they'll do the survey again in 21, but it'll take till 22 before they release the results. But the first question is, have you felt sad or hopelessness almost every day in a row for 2 weeks or greater, so that it affect your usual activities, not in your lifetime, but in the past 12 months? And basically that is asking, you have clinical depression? Not that simple depression where you can just, a couple of days but this is, not pull yourself up by your bootstraps or somebody hit you on the shoulder and everything okay. If we look at our nation, it's 36.7% of our students, or over 1 out of every 3 students. Next question they ask, have you seriously considered suicide in the past 12 months? Nationally, 18.8%, almost 1 out of every 5 students in our classroom. Think about that count out in a normal classroom. 1 out of 5 is, considered suicide as their only hope out of the situation. Question number 3 is, have you made a plan how to attempt suicide in the past 12 months? If a plan has been created, they know where mom keeps the pills, they know where dad keeps the gun. An attempt's almost inevitable. Nationally, 15.7, almost 1 out of every 6 students in our nation. And the last question they asked is, have you attempted suicide 1 or more times in the past 12 months? In our nation, it's 8.9%. Almost 1 out of every 11 students in our nation have attempted suicide in the last year. So what can be done? Suicide's an impulsive act, or is it? No, 4 out of 5 completed suicides, they give clear warning signs before the attempt. So what's that basically means? It means 80% of the suicide attempts, we have the opportunity to recognize the warning signs and intervene. So that's kind of what we're doing today. What can we do? What can we do? That's what we're all joined together today for. We can increase awareness. You're doing that. That's one thing that we're talking about today. Dispelling myths. Someone who talks about suicide is not at risk. Well, that's a myth. If they're talking about suicide or telling you that they have suicidal ideation, they're telling you honestly. And we're going to talk a little bit about education, learning warning signs and elevated risk factors. Signs of concern. Signs of concern, suicide threats. These are mainly a lot working with our youth. It's suicide threats. I'd be better off dead. You won't have me around much longer. Keep those in mind. I know some people say that, they just want to get attention. If a youth tells me that, you have my attention. So keep that in mind. That's a sign of concern. Previous suicide attempts. That's another one that puts you at a higher risk. Depression is something that needs to be discussed with a clinician. Some people that are depressed, sleep all the time. Some sleep none at all. Making final arrangements in our youth. If you're an elderly person and you tell us, you want something played at your funeral, we take that and we understand. But if you're young or the youth, you'd want to know, why would you tell me that? But it all comes to boil down to out of character behavior for that individual. It's out of character for that individual. Make sure that you keep that. And we're going to talk about some out of character behaviors. Abrupt changes in attendance. Just missing all the time. Academic performance declining. And that's not just in one subject matter. In our youth, that's overall performance. Sudden failure to complete assignments. Of course, that's going to affect your academic performance. Lack of interest and withdrawal. No longer wanting to play a sport, or no longer wanting to be on the cheer team, or something's changed. Sudden changes in appearance. No longer seems to be caring about the grooming of yourself. Changed relationships with classmates. Kind of pushing classmates to the side. Increased irritability. Aggressiveness. Preoccupation with death. We ask teachers sometimes to look for little notes and stuff on kids' papers or poetry they're writing. Are they talking about death? That attitude of just it no longer matters. Abrupt changes in eating and sleeping habits. That kind of goes back to what we're talking about of the depression. Many times signs and concerns, it's just adolescence. You can take them and you take them to a clinician, they say that's normal adolescence. That's perfectly okay. That's a great thing to hear if you're a parent, but it could be something else. Start looking at if it persists over a long period of time, several signs evident at once, or it's out of character, as I said earlier, for this individual. Some of the risk factors, we're going to look at some risk factors. This just kind of puts you in that higher group, that not that you make you suicidal, but it's a possibility of suicide. Let's look at some of them. Prior suicide attempts, we spoke about that. Social isolation. Look at right now, we have COVID going on. Sorry about that. Mental illness. With COVID, it's kind of, both of those are very strong. We had time in our schools where, the kids had to miss a week here, where they had to take a snow day in the middle of summer. We was having a COVID problem. So that can affect that youth. Financial problems. Of course, that's happening at a level that I've never seen before in my life. Maybe people even losing their homes. Job problems or loss, loss of a job. Affecting the family. Relationship problems that can lead into, that could be an effects of losing your job. Serious illness. Somebody that's very sick. Bullying. Not only the bully, not the person being bullied, but it can be the person who's doing the bullying. Years ago, bullying was just done, at school, basically hours of operation of school. Now it's online. It's 24 hours a day on our youth. Sexual, abuse, only can imagine. Barriers to healthcare. It could be that rural area that's needing help. Substance abuse, easily access to lethal means. Some of these kids know how to get a hold of these weapons, or a family history of suicide. That puts you at a higher risk factor. So what can you do? We asked that our school train their school resource officers, encourage schools to do suicide prevention training. We've passed the Jason Flat Act now in 21 states that require these states to do 1 to 2 hours, depending on the state, of youth suicide prevention and training. Not to make you a counselor, but just to make you aware of the problem. I've tried in Florida, and we'll try again. Church, communities. I'm sure there's great people out there that are listening right now. Go out, and all of our program materials are brought to you by HCA, one of our affiliates, at no cost. Go order them. Contact Claudia or myself. Civic organizations. You can go out. Every one of you can do something. We can all do this together. Parent Resource Program is another great tool and resource that we use at the Jason Foundation. It's designed, we call it the PRP. It's designed for parents. It's just a link that we can put on a website, and it just gives great information of tools and resources. What can a parent do? They can click a button, do's and don'ts. We'll provide that for you. Just reach out to us. We'll even create a button if needed. But it just takes you to a link, and take that the information, and if you have time, go to the Jason Foundation and look at the materials. But it's a really good program, especially now with a lot of the hybrid type classes. The kids are having to go do a lot of the work online. Even if the kids click on this, the youth click on it, they're just going to learn information, how to help a friend. Helping a friend, we'll talk about that. It's the B1 program. It's a great program we have for our youth. It's designed to, you may be that only resource, be that one, be that friend. We have a really good program too that, speaking of the first responders, we have a module out. It's a streaming. If you would like to go to that, just go to the Jason Foundation. You'll see it at the bottom. It says first responders. We'll provide rack cards. We'll do trainings for you, similar to what we're doing today. You can do it on your own. You can self-facilitate it. Just to get the information out, please go through it and look at the system. Look at our training. No cost. We'll not charge you a dime, I guarantee you. We have what we call our Promise for Tomorrow, our student curriculum. The reason we call it a Promise for Tomorrow is when we lost Jason, he told 2 people prior to his death. So at the end of the training, it's just taught in a 3 to 5 day classroom setting at no cost. At the end of it, they sign a pledge card that says that they'll promise to get a trusted adult involved if someone another youth tells them that they have suicidal ideation. These are all offered to you at no cost. Everything you see, we offer no cost. Basic rule to remember when we're talking about youth or we're talking about adults is you get professional help for them immediately. Do not try to be the hero. Get them help. They need professional help at that point. Because remember, out of those 125 young people that I talked about we lose each week, 100 of them could have been saved if we'd have just known what to look for. If we'd have been trained warning signs and how to respond, we could have saved 100 of them. That 4 out of 5, just by going through training and understanding warning signs and how to respond. So keep that in mind. Now we're going to switch over a little bit gears because we've talked about the youth and the Jason Foundation and some of our programs, but we have a lot of times what's left out. I started doing police trainings for our local Hendersonville Police Department years ago because they had asked me to do it. And we would just sit and we would talk about youth suicide statistics, and then we'd go into, first responders. And I learned a lot. Actually, our oldest child he's a first year firefighter. He just came out of Alaska. He did 4 years in the Air Force and as in fire prevention training. And he's back with us, and he's a firefighter. So I see and I hear him talk about some of the things, and he's already he's 60 days into the job in Tennessee, and he's had to go to a suicide. And it was, I can remember him telling me that the child was the same age as my son. It's just something that we don't talk to a lot of times. We have to start thinking about traumatic events and that what the first responders go through. There's it's just not like you can shut that off. It's something that may affect you for quite some time. There's a great quote that I like to talk about that because you just can't turn it off. If we expect that you can be immersed in suffering and loss daily and not be touched by it, it's unrealistic that it's expecting to be able to walk through water without getting wet. There's no way that you can take somebody, you went to a major scene, it could be a crime scene, it could be a burn victim, or it could be a suicide attempt, and you take them to the emergency room and it just ends there. There's you have to have that time to calm down and take a breather. We're seeing this more and more in our firefighters and our EMS employees. And it goes right in line with what we talk about. Did you know more police officers and firefighters and EMS die by suicide than in the line of duty? And some of the numbers that I can talk about is, in 2017 I could find numbers on firefighters. We lost 103 firefighters to suicide and only 93 on duty. If you look at police in 2019, you had 228 police suicides and 89 die in the line of duty. And that's according to the FBI report. Suicide takes 2 to 3 times the number of officers' lives than being killed by a felon. Risk of suicide among police officers is 54% higher than among American workers in general. Imagine that, puts you at a higher risk of 54% just by going in that type of service. We've got to start keeping an eye. I call it guard your buddy, looking out for the one that's near you. And we've got to start watching out for our first responders. Issues that are more commonly dealt by first responders are what we call acute stress disorder, PTSD, and depression. And we're going to look at those a little bit. An acute stress disorder is, or an ASD, it's easier to say. It can develop following a person's exposures with one or more traumatic events. Basically when you go to a potential violent call, could be something that comes back, a memory. Call involving a suicide, homicide, or cases of child abuse. Could be going to a car accident, fire, medical emergency where individuals experience suffering, seeing someone suffer, or a death even, or performing a death notification, chasing an individual on a foot or car. You have that point to where you've been running, you're after somebody. It could be it's affect you later on. If you kind of look at because I've always thought ASD, and that's kind of a new one on me. I always just considered it PSTD, which is a post-traumatic stress disorder. Kind of, if you look at the little bit differences of it, ASD versus PTSD. ASD is diagnosed usually within that 30-day range, where PTSD is going to be, a month or longer after the event occurs. And ASD, it's going to last between 3 and 4 weeks usually. And PTSDs last about a month, and it can last several years if not taken care of. ASD symptoms are severe anxiety. You can start having a poor concentration, nightmares. Where PTSD, on the other hand, is you're going to start doing avoidance, highlight, mood changes, your cognitive thinking will change. ASD treatments usually a short term, just therapy, medication may be able to help. Where PTSD, it may take longer. Keep that in mind if you're a chief or somebody of higher authority, it may take this individual a little bit longer to get over it. You know, it's usually going to take that therapy as well and medication for a much longer time. PTSD and depression rates among firefighters and EMS are more than double that of the civilian population. So kind of keep that in mind. You know, that I know that I was telling you our oldest child is a firefighter, and they have his chief will sometimes sit down and he'll say they'll talk with them after an event, you know, because they know that that what they've just experienced is maybe something they need to speak with someone about. And you just think of that, double the population for an EMS worker. And for police officers, it's been found out it's about 5 times higher than the civilian population, 5 times higher with PTSD. You know, so in general, firefighters suffer about 14.6 to 22% PTSD, and 35%, if you kind of look at the numbers of police officers suffer from PTSD. If you kind of break that down to the general population, it's about 6% of the civilian population suffer from PTSD. So it's an event that we really need to look at where they can put you at a higher risk. PTSD, you know, if we start looking at the elevated risk factors on it, you know, associated with alcoholism, drug abuse. It could actually go into your family. You know, it could be over relationship problems, depression. You know, depression, as I spoke earlier, that's one of those things that, you know, somebody may eat everything that they can get around them. Some people may not eat at all, or sleeping, you know, sleep all the time. Some sleep at all. Make sure that, you know, that you're speaking with a clinician. And it puts you at that higher likelihood of thinking about suicide or you know, making an attempt. You know, I always talk about, you know, that, you know, if you get a cut or something, it's going to leave a scar. You know, we can treat that scar. We bandage it. We put, you know, stitches in it. But some of the things that our EMS workers are seeing, you know, it's an injury that you cannot heal from, like in that nature. It's something that you can't just move on to your life. It's something you may have to speak with someone about. That PTSD is not something that you're just going to shake off. Keep that in mind. Depression, you know, it's that silent killer. You know, first responders, it builds up slowly and it goes unnoticed. Due to constant work-related fatigue and other stressors. You know, I know that watching my own child, you know, on 24, off 48, that's a different schedule. I'm sure that he's grown used to that, but just making sure to watch out for your friend. I know that that depression, it's something that you do need to see a clinician. So depression, you know, I talked a little bit about it, but you know, symptoms of depression can go on. You know, changes in sleeping patterns. Talked a little bit about that. Feeling worthless, you know, guilt. It could be that even guilt that you feel as if you could have saved somebody that maybe have lost their life at a you know, at a car crash or something. That you have this guilt. Depression starts kicking in. Difficulty thinking, you know, making decisions. Depression can start changing the way that you know, go home and talk to your loved ones, or how you know, start looking out for your coworkers or avoiding them. Lack of interest and withdrawal. You know, that can be the same thing if you're starting to see one of your you know, your coworkers pulling away from you know, if you enjoy doing things together, fishing or playing golf, and all of a sudden they're starting to stay, you know, in their home by themselves. Ask them, you know, just ask, are you okay? I guarantee you, if they're having suicidal ideation, they want to have that conversation. Abrupt changes in moods, you know, that mood change. If you're starting to see that in you know, someone that you're working with, make sure, ask them, it could be just normal, hey, Morgan's not in a good mood today, but ask them if you start seeing over a long period of time. Thoughts of death or suicide, especially if they start talking about that. One of the myths are that we fight in the youth all the time, or if someone's talking about suicide, they're not thinking about it, or if you talk about suicide, that it puts that thought in their mind. That's not true. I guarantee you, if you talk about suicide to somebody, or you ask them if they're having problems of thinking about harming themselves, you've just given them a way to talk to you, to communicate to you about that. I always refer to it years ago of teen pregnancy. Growing up as a child, not talking about it. A young girl become pregnant when I was in school. She just vanished, went away. If you got anything out of the staff, it was, she went to live with her grandparents, and you knew what was going on. If a teacher in those days became pregnant, she had two choices. If you had tenure, you could resign, or do a leave. Or if you had no tenure, you just had to resign. You had to forfeit your job, because someone at that time thought that if we saw the effects of that pregnancy, that we as kids would think about having sex. Of course, that's wrong. We look at that now and we laugh at that. Suicide's kind of that same way. We're not talking about it. It's doing nothing. It's doing no good for anyone. We have to talk about it. We have to break that silent epidemic. Won't be silent anymore, is what I say. So how would you know if someone's first responder is suffering? Because we know that first responders are trained to deal with people who are suicidal. You're trained to do it, but sometimes we don't kind of understand what to do when we're hurting ourselves. When we do our programs at the Jason Foundation for the Youth, we teach it in that third person. You're helping another youth, but guess what? They're learning also where to go to get help for themselves, and that's what it's what it is. Start watching out for individuals. Make sure that you have places for them to reach out to, somebody in your office that they can speak with. Warning signs for first responders. It's very similar to what our youth it is as well. It's hygiene, feeling out of control, taking care of themselves. Same thing as hostility, argumentative, feeling that hopelessness. It's the same thing as our youth, just an adult talking about it, talking about death or suicide, even glorifying it, it's talking that I'm going to end it all, wish I was dead. You can also have the less verbal clues, such as soon I won't have me around, who cares if I'm dead. If I hear things like that, I'm going to ask somebody, what would you say that for? Self-isolating, we talked about that. We'll start watching out for your friends. They're your friends. I guarantee you, I would rather ask you, are you having issues, is to go to your funeral. Critical warning signs, reckless behavior, not caring, a lot of times could be for a police officer, using your weapon unsafe, reckless, not caring about your job, almost just no care anymore. Or you start seeing them have recent issues with alcohol or drugs. They're your friends. You see this in them. Could be that something is just saying life's hopelessness, or giving away cherished possessions. We see a lot of that in our youth, giving away, a baseball card collection or something that was important to that individual. Make sure you want to know, I love a gift like everyone else, but I want to know why you're giving it to me, because sometimes they're just not planning to be around to use it anymore. And the mood swings are the same. But be prepared just to ask that question the moment you realize. It's one of the hardest things you can ask somebody is, are you suicidal? But I guarantee you, after you ask the first person, it's easy. You just ask. Make sure that you understand. That is the question you need to ask. Have a protocol in place. Claudia can help you. I can help you. I'm sure your department has one. Know those resources. I guarantee you tell everybody at home to make sure they have the poison control and everything on their refrigerators. There's, I can give you some information, but make sure you reach out, look for your local areas that can, crisis referrals for first responders. There's, you can text badge to the 741-741. There's plenty of places and outlets that you can look for. Trainings. We need to make sure that, how quickly we can just bounce back. Make sure that your department's setting up trainings, that can help, especially after you go to a scene that could be something that's, taking effect on your staff. Educate yourself and your colleagues about the being a first responder. Have a plan for when you get back. Let's let some stress off. Talking about bouncing back, just talk to your family and your friends. They'll support you, and engage in community activities, enjoyment. Life's fun, something I need to do better, and I'm sure everybody else is exercise daily, but it does help, that running, stretching, develop and maintain a healthy eating habits, and that bedtime routine, identify, positive influences, bring that person that makes you happy around, and find what brings positive feelings to you and enjoyment to you. Do it for your department. Eliminate that stigma, of getting help. My father was in the Korean War and Vietnam, and I saw that as a youth. He would not reach out for help. He just feel like that wasn't, a good soldier, I guess. But I guarantee as he got older, his changing, he changed a lot. Make sure that, if I can say anything, it's that top leadership down. Just, give them that salute, something that somebody would come talk to you. Give them that ear, that the person to listen. Sometimes just listening to somebody and telling them you understand, it can make all the difference. Help them out, just that able to listen. If I can say anything, it's just listening sometimes. It's going to make all the difference in the world. Don't try to be a counselor. If they're telling you to think about harming themselves, you get them to the nearest facility for the help. But just listening, it can do a lot. If you do think that somebody is in danger, and of course you know this, just do not leave them alone. Guarantee if you're a police officer and you pull somebody over for a DUI, they're going to tell you anything you need to hear. I'll never do this again. Won't do it. It was just a one-time thing. No, you don't leave that individual. You don't leave them. You make sure you go with them. You take them and you get them help. Make sure that that they you do your protocol, but go with them. Get them help. And if you have a doubt of anyone's intentions or concern about their behavior, get professional help. Please, immediately. Don't try to be that counselor. Get that individual help. And I did end with 5 minutes early for questions and answers. So if you want to reach out to the Jason Foundation, we're at 18 Volunteer Drive. You can call here. It's 615-264-2323. You can go online and use all of our materials are at no cost. Everything we do it. It's not free. We have affiliations like with HCA but we'll provide all this information to you at no cost. How about questions? Any questions for myself?
First, I'd like to thank you for your time and attention this evening to such important topics, especially to first responders, and also remind everybody else out there that is watching that we also do have the redlinerescue.org website that is up and running. That is a match.com, both for clinicians and peer supporters for first responders. Claudia and Morgan, as we round off the Facebook portion of this discussion, I'm very grateful to have you here this evening. I'm going to stop the Facebook feed right now, but thank you again for being with us. With that, we are going to continue our discussion of I'm really stuffy. I'm sorry, I'm having allergies, of youth suicide prevention and first responder suicide prevention on record for our YouTube page. And now ask if any of our participants do have any questions this evening for Morgan or Claudia.
I have a question for Claudia.
Go for it.
For the different behavioral health, like inpatient facilities that you described, are there, do they have any policies or procedures in place for, like, say, a first responder, if they were to come voluntarily, or I guess involuntarily, but voluntarily, are they in with the general population, or is there any wing or ward that is separate for first responders?
That's a great question, Brianne. So they are not separated, but we are able to offer something called a direct admission, which means they would not have to go through the emergency room. That's assuming, well, if they're voluntary, then they don't need to be medically cleared. So to avoid the emergency room, we would expedite their intake process and they would just go straight to our intake department. We do receive quite a few first responders, and what we've noticed is we receive them from other counties. So we're in Osceola, but we receive them from Orange or Brevard, other counties that perhaps they feel more comfortable going instead of the own county that they cover themselves.
So they could go to like a different county's facility. That way they're not in with people potentially that they've run on or could be running on in the future.
Yes, that is correct. Because they're voluntary, they can pick and choose where they go.
Okay, I appreciate you. Thank you.
You're very welcome.
Thank you for asking such an important question, Brianne. Are there any other questions that we can answer this evening while we are recording? I know that I kind of honed in on that hopelessness factor, Morgan, that you were talking about. There was a pretty extensive study that came out of Florida State University about the topic of hopelessness in first responders and just how it contributes to the higher rates of suicidal ideation, thoughts, and behaviors. I don't know, maybe if you could explain more in detail what hopelessness is, maybe for everybody, so we have an understanding of what that is, so that our families and our loved ones are able to better identify maybe what that might look like in their first responder.
Of course, I mean, hopeless, I deal with that a lot, and that is a good question, because once you feel hopelessness, I mean, it's almost, what's your other choices? In the youth, a lot of times, we'll see that it's hard to explain. As an adult, we understand that what you're stressing on today may be something that they're stressed on, if it's a house payment today, it may be something totally you're stressing on differently in the future. And I deal with a lot of the youth, just, that one more day, that's, we try to talk to the youth a lot of that. When I talk to the police as well too, that if a child, a youth especially, is in trouble for the very first time, and not trouble as in a breaking curfew, but trouble as a DUI or getting arrested for something, that sometimes we as adults, we want to say, you've ruined your life, or these, we start putting these harsh things on them. That can put you in a hopelessness situation too, where you just feel, I got no more, when I do local police trainings, I make sure that they understand a lot of times, it's the way we say things sometimes, not that you've ruined your life, but sometimes it can be as simple as, you've done, this is bad, but these are the ways and steps. Now I'm going to give you 3 steps to make your life better. So we have to keep that in focus of, especially, in our youth and our adolescence, it's the same. It's giving them, hey, here's your mistake, and let's these are how we move forward. So you have clear, what's coming.
Yeah. Thank you for answering that. I'm gonna follow up with the question real fast, without violating HIPAA, right? Do you have any data or statistics that suggest increased rates of different mental health challenges, maybe in first responder, adolescent, kids of first responders?
I don't have that. I can look though. I'll be glad to look for you. But you're probably right that we could probably find numbers on that, because think what someone's bringing home. You've seen that event, and now they see dad, mom or dad over there that's that they know something's wrong. You're not talking about it. I'm sure.
Yeah, I mean, I'd be interested to know that. I know that when I was out at Surfside, I didn't see my daughter for the better part of 3.5 weeks, and we had frequent conversations. What is mommy doing? Why is it so important that she's here? You know, and all these conversations. And so, you know, maybe we'll have you back and have a discussion, more narrow focused into that first responder children of first responders kind of conversation. So, but I could imagine that the number could be quite high. Like, oh, I saw daddy on TV, you know, in the middle of the Everglades looking for someone, right? And what about
Right.
Peter's mom? Or, you know, daddy's in that fire and they saw the roof collapse. What's going on? And so I can imagine that anxiety and depression might be something that we are frequently seeing, and thus maybe some substance use in our adolescence then to kind of cope with the feelings that our kids are having because of the career choices that we made. So hopefully we'll have you back for something like that. So
That's a great question. Actually, it's well noted. Yeah, because that is, you know, I've never really thought about, but it could put, you know, that family at that youth at higher risk for sure.
yeah, awesome. So hopefully we can grow that discussion out. And I'm gonna my lip and say, does anybody else have any questions before we turn off the recording and have our non-recorded discussion?
Hey Morgan, I want to thank you real quick. I did have one more thing to ask, and I really thought you hit on really on point, was being that person to ask. Some struggles are well documented. Some struggles are out in the open in our firehouse. We know when somebody has cancer. We know when somebody's dealing something with their family, and the support is usually immense. We're there for each other when we know somebody is struggling. But when somebody's struggling internally with some thoughts of potentially suicide or not being able to deal with something, I think you really hit the point that it really comes down to their close friends, knowing that person, having that conversation, and being there when you know that person's a little off that day. And you only know by asking them, hey, how's your day? Or what's going on? Hey, did you go out on the boat last week? No, you haven't been out in a couple months. Why not? What's going on? And being close and open with the people and really being that friend is that first and maybe last line of defense, to just ask those questions and make sure that everything's okay and that guy's good to go on for the next. We all go through our own thing. So I think that's huge. I try to be better there and try to preach that to everybody else here, to just try to keep an eye on each other, right? Look out for each other. Don't just blow it off. If you see something change, ask, right? That's cool.
That is perfect. That is spot on. You know, you have to watch out for your teammate. I call it, you know, what, just go, you know, making sure that you're looking out for your buddy. It's just, and you're right. They'll start showing these signs. You know, it's making sure that you ask them. Sometimes just not asking, and you're with each other at a firehouse 24 hours a day. You know, so you're seeing this individual. Just making sure. It's just that it's asking somebody. It's just asking to make sure that it's okay to struggle. You know, it's okay to have. It's okay to be sad sometimes, but we just need to watch out. That's exactly right. With the youth, we try to make sure that you know, that you're looking out for an individual. You're looking out because sometimes they just want somebody to speak with. I agree 100%. Just watching out. Go ahead.
Like teaching people, like, you don't have to have the answers for everything, right? But you do need to be able to say, hey, are you okay? And then get them to someone who may have the answers. And I think, at least in the fire service, we're scared on what's on the other side of asking, hey, are you okay? Because then we have to kick that feelings door open, right? That big F word. And it's not what we're thinking. It is feelings. And oh, now we have to deal with this guy's feelings. No, but who better than us? We spend a third of our life in a firehouse. Who better than us to say, hey, you know, are you okay? No, you're not. Well, let's talk about it, and then get you to someone else who can get you some resources. But at least we opened the door and started that conversation. and reduce that hopelessness, right? All of a sudden we matter to somebody, and that's a big deal.
Very big deal. We all want to matter. We all do matter, you know, we all matter.
Yeah, awesome. Thanks, Craig, so much. And I see a
Thanks,
question.
Greg.
I see a question in the chat box for you, Claudia. If a first responder or anyone really needed to come for an immediate need to an HCA hospital, can they come to the hospital, and how would that work?
Yes, so not all HCA hospitals have a behavioral health program, so just keep that in mind. So in that case, what I would definitely recommend is first contacting the intake department just to let them know what's going on. They can do like an assessment over the phone, and they would recommend or explain the process after that to come to our intake and go directly into our unit instead of going through the emergency room. If you just show up at the hospital, they may have you go through the emergency room and then assess you, and then possibly Baker Act versus calling us, letting us know what's going on, and then we can avoid that and then go directly to the unit instead.
I'm going to follow up with a question and ask you, is there maybe a phone number or a specific, UCF Restores, right? One of your partners in the area have a specific contact line that someone can call. Do you have an allocated line for people who may be living with mental health challenges to kind of get an idea of that?
Yes, so we have a 24/7 intake department. It is staffed by a licensed clinician and a psychiatric nurse practitioner. I'm going to put that number on there. It was also in my presentation, and I can email you those slides, Michelle, if you want to share it with everybody else.
So those are going to come up in the YouTube presentation, but just for the sake of answering questions, I see that you put it there. So to repeat, it's 407-518-5835 for that 24/7 hotline. Thanks so much, Claudia, for that.
You're very welcome. And also, before I forget, I also shared a flyer. We are doing a mental health summit for first responders on Tuesday, October the 5th. Morgan will also be a presenter, and we also have 2 first responders that will be sharing their own personal journey with mental health. It will be done in person at our hospital, or you're more than welcome to participate virtually as well. The flyer is on there. It explains how to register. We would love to have you and just start this conversation. This is how it all starts, is talking about it and normalizing it. So we are super excited to offer this to the first responder community.
We're so grateful that you're starting that conversation for the first responder community. Any conversation is a step in the right direction. We are grateful for that. Thank you.
Absolutely. You're welcome.
Flyer is in the chat, Claudia. We appreciate it. Are there any other questions while we're still recording to be that anyone would like to ask? Okay, with that, as we round off our recording, I do just want to thank everybody for being here this evening, and definitely feel like we need the opportunity to have you back in the future to discuss youth suicide and youth suicide prevention in a follow-up conversation. So I will be in touch with you for that. As we round it off, I'm going to say, hey, Mark, Yorleyu. Mark, while we're recording, would you like to give us some words of wisdom to end our recording, please?
I would love to, and I would be honored to. This week, I was able to listen to a podcast that had our very own Jeff Orange on it. And it was Tailboard Talks that's done with our friends Second Alarm Project with Kelly O'Dare and Michelle Raven. And Jeff was talking about peer support and that kind of stuff. And I see there's a lot of similarities with the family caregiver section and peers. Our family members are really our peers in the house as opposed to our peers at work. And my good buddy Jeff Orange one of his quotes that strikes me to the core is he says, we can't rob somebody of their rock bottom, which means people are going to struggle, and we're going to try to do everything in our power to help them. But till they hit that rock bottom where they can't do anything else to recover, that's where the change happens. And that's where we come in, and we have to meet people where they are. We don't try to pull them up to where we are. We have to meet them to where they are. And with all the strife in the world, I came across a little poem. It's called a prayer, but it's the Archbishop Oscar Romero prayer, and it's called A Step Along the Way. And it goes like this. It helps now and then to step back and take a long view. The kingdom is not only beyond our efforts, it is even beyond our vision. We accomplish in our lifetime only a tiny fraction of the magnificent enterprise that is God's work. Nothing we do is complete, which is a way of saying that the kingdom always lies beyond us. No statement says all that could be said. No prayer fully expresses our faith. No confession brings perfection. No pastoral visit brings wholeness. No program accomplishes our full mission. No set of goals and objectives includes everything. This is what we are about. We plant the seeds that one day will grow. We water seeds already planted, knowing that they hold future promise. We lay foundations that will further develop. We provide yeast that produces far beyond our capabilities. We cannot do everything, and there's a sense of liberation in realizing that. Then this enables us to do something, and to do it very well. It may be incomplete, but it is a beginning, a step along the way, an opportunity for the Lord's grace to enter and do the rest. We may never see the end of our end results, but that's the difference between the master builder and the worker. We are workers, not master builders, ministers, not messiahs. We are prophets of a future, not our own. No words that we will say will make all of the difference, but it may make some. No smile that we give can alter someone's year, but it may alter their day. Sometimes we do not see the difference that we are making in the life of someone else. We often don't know what to say or what to do, but I can assure you that being present is the best present that we can ever give. In a world where you can be anything, be kind. You matter.
Man, my heart just bursts. Thank you so much for that, Mark. In a world where you can be anything, be kind to each other. Thank you, Claudia and Morgan, for joining us this evening. I am going to stop the recording.